Welcome to Power Up Recovery with Nutrition. It is time to make nutrition part of the conversation. I'm your host, Christina Veselak, and I'm so glad you're here. Did you know that it's our brain's job to allow us to cope with stress gracefully? But to do that, it needs to be fed optimally. Have you ever wondered why so many committed people relapse or maybe even die? Why so many people on psychotropic medication still feel lousy and still have cravings? What if the missing piece is food, the right food? What if the right nutrients like amino acids or even eating protein every 4 hours could actually balance your brain chemistry and your mood without medication and support lasting recovery? In this podcast, we explore the powerful connection between feeding your brain well, mental health, relapse, and recovery from addiction. We will share insights from experts, inspiring recovery stories, and practical strategies you can use today. Whether you're in recovery, a healthcare professional, or someone passionate about emotional well being, this show is for you. Let's dive in and discover how fueling your body and brain with the right food, the right amino acids, and other key nutrients can fuel your transformation today. Welcome. Welcome to another episode of Power Up Recovery with Nutrition. I am Christina Veselak, your host, and today we're talking about the amazing world of genetics and nutrigenomics and epigenetics. We'll explain all those terms in a minute, and how they can impact and sometimes even drive mental health issues and addiction disorders. And therefore, when addressed effectively using nutrition, this is where the nutrigenomics comes in, how we can positively and in a very precise, directed way impact your recovery journey. We're going to
Yes.
introduce Val Prisecaru today. Val, welcome so much for being on our show. And thank you so much for agreeing to speak at our conference in Columbus in May.
Oh, thank you very much. The pleasure is all mine. I'm very much looking forward to it. And I'm really glad to be here with you today.
So, can you tell us a little bit about you, your expertise, and what brought you to this amazing specialty?
Oh, sure. So I'd always been interested in health and nutrition. I grew up in Los Angeles, and I was introduced to some alternative medical and alternative wellness principles back in the 90s. Eventually, I went to school for it. I went to University of Illinois, and I got my bachelor's and master's in nutrition. Now I'm working on a doctoral program at the University of Bridgeport, and one of my focuses is actually neurotransmitters and some things in the addiction and mental health space. I am currently the genomics, nutrigenomics consultant at Designs for Health.
Okay.
It's a wellness nutraceutical company. They used to do just supplements, but in the last couple of years, they've gone into the testing space as well. So they have different types of tests because in order to know what is best for you as far as foods, supplements, lifestyle, then knowing labs, microbiome, metabolomics, genomics, really you can fine tune your wellness protocol. So I've been doing a little bit of that, consulting with a few companies, doing a little research, and just trying to help as many people as I can, and however long I'm here for.
That's amazing. We're really talking about precision medicine, aren't we? Which a lot of people call the future of healthcare.
Yeah, that really is true. Medicine used to be quite imprecise. I mean, to the point where doctors would taste a patient's urine just to see if it's sweet to know if someone had diabetes. We're talking many, many decades ago. course, now we've come a long way, but in my opinion, even 10, 20 years from now, we're going to look back on 2024 and say, hey, we were in the Stone Age back then. That's how far I think we're going to be advancing in the coming years and decades.
Well, I think so. I heard Dr. Daniel Amen speak recently about how tragic it is that psychiatry is still really in the dark ages because, again, it guesses. It doesn't look, it doesn't take off the hood and actually look into the engine itself to see what's wrong. And then they wonder why they have to move somebody from one medication to another because they're not getting the results they want. It's incredibly imprecise.
Yeah, absolutely. And the field of psychiatry is imprecise for several reasons. Um, I would say one major reason is there's no strong financial impetus to do more natural medicine and or preventive research.
Mm-hmm.
So if your pharma company can profit $1 billion off of a drug that will help reduce symptoms, they'd rather do that than figure out what the actual problem is, because then you would get off of them completely. Like, for example, um, I did some research into sales and marketing of mental health pharmaceuticals in the U.S. last year, and I think if you look at all drugs prescribed, if you take away medicine for high blood pressure, which doctors almost force people to be on, hey, you're going to die. And if you take away insulin, right, which
Mm-hmm.
also, like, you could die, right, if you're a type 1 diabetic or if you have very severe type 2 diabetes. If you take away just those few essential medicines, guess what the number one most prescribed medicine in America is?
Prozac?
Adderall. Adderall.
Adderall. Oh my
And
goodness.
Prozac is high
Okay.
up there too. And so
Right.
is Ritalin and all those, sertraline, and then you get later on down the line you get benzodiazepines and some other ones, but really, um, SNRIs, SSRIs, and SSNRIs, those three are really, really, really highly prescribed. So then the question begs, why do you need a norepinephrine or a dopamine reuptake inhibitor when you can just increase dopamine, or maybe increase
Yeah,
the health
exactly.
of the cell, um, of all your cellular membranes with omega 3s and some other things. Um, uh, Maybe you can inhibit the genes like COMT that break down dopamine to increase it naturally. And there are even natural supplements that also reduce reuptake of some of these neurotransmitters. So why not
There
just
are.
do it naturally, right? Well, that's because there's no $1 billion. You can't, I mean, I can go buy a year's worth of 5-HTP for like $100, you know?
You could. And
Uh,
probably St. John's wort too, which has that wonderful, reuptake
St. John's wort, yeah. St. John's
inhibition.
wort really, really, really has great effects on some people. I remember a couple years ago, I think I bought 40 years worth of vitamin D for $40. So, you know, if you look at the numbers, then it
Uh-huh.
starts to begin to make sense.
Yeah.
What's the prime directive? Well, for a corporation that has some ethics, it would be make money and help people, right? But for a corporation that, let's say, is run by not very ethical people, then the prime directive is to make money, and they don't really care if they help people, as long as they look like they're trying to help or they sort of help. Then that's okay with them. But obviously, it's not okay with us, and it's not okay with people in general. So that's part of the whole process of waking up. People are waking up now. They're like, wait a minute, I thought that was just some crazy theory, but now it's actually true. Oh yeah, well, yeah,
It is.
the biggest payouts, the biggest crimes, the biggest civil lawsuits, unfortunately, have been against pharmaceutical companies. So
They happen. Well, and that's why this podcast is titled Power Up Recovery with Nutrition, because my goal, and I think yours is as well, is to empower the general public with this information so that none of us are dependent upon um, pharmaceuticals or psychiatrists to repair and support our brain function. And therefore, by repairing and supporting brain function, improving mood, improving behavior, improving addiction, treatment and recovery, and thriving as human beings.
Right. Yeah, it's really important. Long term, long term, uh, good health and improved outcomes, I think would help everybody. And if we focus on the positives and not necessarily the negatives, I think we'll be able to do even better. So I'm not really I'm not really against um, pharmaceutical companies. There are some drugs that I think are great and they work, and
And they save
even
lives.
yeah, and they save lives. So even things like Adderall, Ritalin, Prozac, Zoloft, in certain segments of the population, based on genetics, uh, something like that temporarily could really impact someone's health. So I'm not really against that. However, uh, if you look at the actual state of affairs, the state of the union, so to speak, today,
Mm-hmm.
in theory, doctors temporarily prescribe benzos, temporarily prescribe SSRIs, temporarily prescribe this or that, and then it just
Or,
becomes you just keep taking it.
right, or temporarily prescribe Suboxone and Methadone, which is how they were originally designed to be
Right.
short-term detox supporters. The problem is nobody was working on rebuilding neurotransmitter systems. So you get off heroin onto Suboxone, and then they try to pull people off Suboxone, and the brain goes crazy, and so do people because their neurotransmitters are still very, very depleted, that the brain cannot function without that type of support. As we both so well know, once you bring in that neurotransmitter support, with dephenylalanine, with all the aminos to rebuild POMC, which is the precursor to our endorphins, and et cetera, now the brain is getting what it needs. And once it gets what it needs, people can come off Suboxone, they can come off methadone, they can come off these other drugs because the brain is functioning. You know, an analogy, Val, a short story. I had a client come to me who said she was going to need years of of counseling for her emotional eating, that she was a compulsive overeater for 30 years. Turned out she was eating potato chips nonstop. And her
Oh, yeah,
3 day
that's another problem. So,
Yeah, in her 3 day food diary, this woman was eating potato chips, vanilla ice cream, and had exactly 2 deep fried chicken legs in the entire 3 day span. And my heart broke for her. And I said, look, I'm not going to take anything away from you, but let's just add a few things. Would you be okay with adding a few things? So we added 80 grams of protein, 20 grams every 4 hours, and 9 servings of fruits and vegetables. Because my theory was that her brain was trying to make up in quantity of potato chips what it was missing in nutrients.
yeah,
And
absolutely.
that next week, that woman came in radiant, Val. She had not had one potato chip nor one bowl of ice cream the entire week. She hadn't wanted it at all because her brain was now finally being well fed. And that's what we do with these nutraceuticals.
Yeah, that's a very good point. Once you have the proper, the proper nourishment, macronutrients, micronutrients, some different botanicals, you
Mm-hmm.
combine that with a little bit of exercise and stress management. All of a sudden, it's a new person.
you've got a new person, and these things can help you sleep better. And so sleep is crucial as well, because we don't believe in a one-legged stool. It's not all brain chemistry. We also believe in healing trauma and lifestyle and spiritual growth and all of that. But we do have to feed the brain what it needs to function optimally for everything else to work. So given your expertise in nutrigenomics and epigenetics, and if you could explain those terms, how can we use that to precisely determine what any particular person's brain needs?
Well, that's a very good question, Christina. And I think to start off, I would say what I do when I first get a patient and they're having some symptoms where I think maybe there's some addiction issues or some neurotransmitter catecholamine issues. The first thing I do is, of course, I just talk to the person and just kind of get an idea of, is this person having more anxiety or more depression? I like
Mhm.
to I like to take things that are bimodal, kind of see along what part of the spectrum someone lies. And then maybe I'll ask about activity level. Is this person completely sedentary? A little exercise, exercise over a day, maybe over exercises? Are they, training for a marathon? Um, I look at dietary habits. I try to get an overall
Mhm.
picture of nutraceutical supplementation, protein powers, bars, etc. And then we dive into the biology of it. So we look at genomics. I usually run a genomic panel, um, and then occasionally I we do a stool sample, a microbiome test, and then a metabolomics, which is a urine
Mhm.
do at home test. All these tests are do it at home. Really nice to do.
Yeah.
And for neurotransmitters, there are, of course, several different. Besides endorphins, you also have tryptophan and its eventual conversion to 5-HTP and serotonin and melatonin. Then you have the kynurenine pathway, which there are ways to, there's like a kynurenine ratio and quinolinic acid ratio. There's different types of ways to measure whether you're creating some toxic um, compounds in your brain or not. So
Mhm.
using simple metabolomics labs and genetics, you could figure out which way someone's going. The same way if someone had some sex hormone issues where they have like a beta versus alpha. Um, this is a issue that happens for the conversion of DHT, dihydrotestosterone. Some people have like very, very, yin versus yang. So this is a yang, very male DHT, dihydrotestosterone production, or whether it's low,
Uh,
they have the other they're high in the other pathway. So you're able to figure that out with genomics. Um,
well, you are. I want to interrupt you for a moment and just point out this chart that we use, along with everything you've mentioned, to identify where the symptoms of neurotransmitter depletion that people have, because this chart will then allow us, okay, people have symptoms of low serotonin or symptoms of low catecholamines, either low dopamine or low, norepinephrine, symptoms of low endorphins or GABA. And from this, we can then say, they're really low in catecholamines. They have low energy. They may have ADHD. They may be craving, stimulants and buying Adderall, off the street. I wonder why.
yeah,
I
very good
wonder
point.
why, right? And then we can use so we can use this to drive amino acid therapy and other nutrient therapies. But then the answer to the I wonder why question is all the testing that you were talking about, the looking at the gut, looking at the different genetic pathways in the production of dopamine or the production of norepinephrine, or whether giving somebody tryptophan is going to cause more toxicity in their brain or actually help them sleep better.
Right, right. Yeah, very good point. And so all of these should be taken into consideration by the practitioner. And unfortunately, current allopathic medicine doesn't really teach too much. Maybe you take one course in nutrition and that's about it. But I think the field of functional medicine is really booming.
Mm-hmm.
Like for example, I gave a talk at A4M in Boston last month, and there were dozens of functional medicine practitioners, all types, MDs, NDs, DOs, chiropractors, and had quite a few discussions. So I'm really looking forward to how the overall subfield of preventive medicine evolves over the next even the next few months. I mean, there are things that are happening at a much faster rate than they used to happen.
That's right. That's right. So if somebody has, say, is a polydrug user, they're just going to use whatever they can get their hands on to relieve emotional pain. How could you, using some of your genetic testing, determine where the brain chemistry issue is originating from? We can identify the trauma issue, we can identify all of that, but it's all mediated through the brain, right? Some people can have a traumatic incident or more and be really resilient and come through in flying colors. And other people struggle their whole lives and can't get over it. And I believe it's because there's genetic blockages in these pathways in the brain. Can you speak to that?
Oh yeah, absolutely. So there are many genetic blockages, and there are basically there's several different types of issues. The first would be if you have a blockage in a pathway or network. So for example, let's say you're not really good at breaking down dopamine. So
Mm-hmm.
you have very low MAOA, very low COMT, and both of those are the main drivers of metabolizing dopamine, right? So you may have high dopamine levels, and part of that will also impact negative feedback loops because those are in place. So you may have reduced production of dopamine and inability to control dopamine levels. So there's not much to go
Understand.
anyway. But then once
Yeah.
it's there, it builds up really high and it goes high and low. It's kind of like a high tide and low tide, right?
Mm-hmm.
Um, but you don't want that because that can cause a lot of maybe mood swings, different types of imbalances, and the same thing if it's the other way. Let's say you're really good at breaking down dopamine, right? So you break it down so well, you have low dopamine. So now that's what Dr. Blum was famous for, is for figuring out RDS, um, reward
Deficiency syndrome.
deficiency issues. And so that causes addictions and a whole slew of other issues, depression, etc. So the
Sure.
question is, which of these pathways, the dopamine pathway, the serotonin, dopamine to norepinephrine conversion, which of these does a person have? And I could do a quick share screen to show kind of how
Sure.
this works if you'd like. Are
And
you
by the
able to
way,
see my
everyone,
screen?
we go into all of this in great detail in the courses offered by the Academy for Addiction and Mental Health Nutrition. Ah, my favorite chart.
So this chart was developed initially by a very nice gentleman named Peter, Dr. Peter Diadamo, creator of the blood type diet between him and his dad, James Diadamo. And he is a doctor, but he's also a coder. So he wrote this program in Perl back in 2014-15. It's called Opus 23. And this is my genome. So let's see
Oh,
here. We can look up, do a power analysis and see just how high or low every gene is. So we'll zoom in here. Here's tryptophan, right? Tryptophan is converted to 5-HTP, and that is affected by TPH1 and 2. So TPH1 function is a little bit below optimal, but as you can see here, Christina, TPH2 is all the way down in the toilet for me. So what does this mean? This means I have less 5-HTP. What do people with less 5-HTP have? They have less serotonin and less melatonin. Well, no wonder it works really well for me. So if I want to know exactly which TPH2 genes I have, then I can actually click on the gene. It'll tell me a little bit about it. I'm actually the editor for this program, so a lot of the SNPs you see here, I'm the one who put them in addition to Dr. Diadamo and another gentleman, Dr. Greenfield from the UK. So I can see exactly which SNPs I have. And then if I want to click on this SNP, I can find out, like, for example, this one's associated with heroin addiction. Another SNP might be associated with increased chronic fatigue, fibromyalgia, early onset OCD, reduced vascular endothelial growth factor, increased stomach cancer, ulcerative colitis, et cetera, et cetera. But the other allele linked to obesity, waist circumference, Bell's palsy. So there are different benefits and drawbacks to each SNP, each gene. And also, BH4 production and MTHFR affects neurotransmitter creation or manufacturing of it. And if we look all the way on the left side of the screen, L-tyrosine eventually is converted to L-dopa, and by virtue of DDC, finally ends up as dopamine. So you have tyrosine and you have tryptophan, all end up with serotonin or dopamine, which then get broken down by DBH, the MAOs, and COMT or COMT.
Right.
So it's nice to see which pathways people who have low dopamine but high energy, like the typical ADHD person that you would envision, they would have very high dopamine beta hydroxylase, and they have very low MAOA. So then dopamine turns into norepinephrine and then just sits there. So you have low dopamine, and you have high norepinephrine and epinephrine.
It's a bad combination.
Yeah, that's a very, very ADHD combination. So if I look at
this, there's no impulse control.
Yeah, not much impulse control. And there are some other genes too that also play a factor, but this is one of these are like the main sets of pathways for it. So basically, if somebody comes in with a mental health issue and I look at their genomics and then I run their metabolomics urine test, I mean, I don't want to say that I do this, but it's almost like I don't even need to ask them what the problem is. I kind of already suspect, just because I've seen it over and over again. I mean, I've done hundreds and hundreds of these analyses on people. So the same things keep coming up. So it's pretty evident when that happens.
Sure. And just looking at this, for instance, you'll know then that you want to give somebody 5-HTP rather than tryptophan, because tryptophan might have a really hard time making it to 5-HTP, and it's going to be a lot more likely then to go down some of these other pathways.
That's exactly right. Yeah, that's exactly right. And I also do some confirmation analysis and also other types of mental health analysis with the other program I'm working on, which is this one. This program is called Self-Decode. And I'm actually working with the primaries in both companies to do a joint venture, sort of like a little participation on behalf of both companies to create a new test. So we're working on some new things right now that'll probably be launched sometime in spring or summer. So stay tuned for that one. But the thing I like about Self-Decode is it looks at many different types of biomarkers. Like, for example, in the Biohacker Hub app, so to speak, of the program, you can look up and see if you have a high or low phase 1 detox. So phase 2 detox, and compare the two. So phase 1 detox, of course, is CYP1A1, CYP1A2, all the major ones, CYP2D6, all the main liver enzymes. So here, I think I helped, I was on 2 or 3 person team to develop this. It's either this one or the other one, the detox, and there's a few of the panels that are really
Uh-huh.
cool. So here is an incomplete list of the 32 variants. I think they list up to 20, 25 of them. So you can see
Okay.
here CYP2E1. There's several SNPs there, and there's your CYP1B1. There's the 1A2. There's the 2D6. I'm sure 1A1's hanging out somewhere over here. If it's not
Well,
listed, it's
and these CYP genes, they regulate the breakdown of your psychotropic medications as well as other toxins in the blood, don't they?
oh yeah, like CYP2D6. I think CYP2D6 metabolizes some obnoxiously high number, like 25% of all drugs. I mean,
Okay.
it's just ridiculous. Um, just how impactful it is to know, hey, I'm really high on NAT2. I'm low on CYP2D6. I have high CYP, you know, 19, et cetera, et cetera. There's so many of these.
Well,
So, for
and that's
example,
where some of those, like Genomind, some of those other genetic tests that psychiatrists are using to determine what might be the best psychotropic medication choice for a patient, or why the meds just aren't working or are creating all of these horrific side effects.
exactly. So here, for example, so this SNP, if you have both copies of the T allele, which 15% of people are CT heterozygous, so I guess a lower percentage would be TT. But if you have that, you are six-fold more likely to have side effects if you switch antidepressants.
Mm,
Six-fold more, that's 600%. That is a huge number. If some SNP had even a 20% increased risk, would be significant, right? And this is
yeah,
600. So
yeah.
you can see just from a simple ad hoc exploration and analysis of just one SNP and one gene is very impactful for improving not only short-term symptoms, but getting to the root cause of whatever issue or illness, or it's usually a combination of issues that's leading to the symptoms. And that's the beauty of high-level, deep dive nutrigenomics.
Yeah.
I can look up someone's
Could you
TNF.
go, wait a minute, could you go back to that chart again that you were showing us of all of the different SNPs and the different pathways? That one, yes. Because, so many people have heard about MTHFR, but they don't really understand what it is or why it matters. But their doctor may say to them, "Oh, you have MTHFR," and so they come to me or one of my trained coaches and say, "I have MTHFR," and we say, "Well, do you have one, two, three, or all four of the potential SNPs?" And they look at us blankly and say, "I don't know."
Right.
So that this is a problem where a lot of the medical professionals actually may not understand some of these distinctions themselves, but it actually matters. For those in our audience who have heard about MTHFR, could you speak to that a little bit and how it impacts mental health and therefore addiction,
Oh, of course, absolutely.
and how
So,
we might want to address it, nutritionally?
oh yeah. So MTHFR is, of course, very relevant for a lot of different health aspects. One of which is mental health, but there are a lot of other things too. One of the most common and well-researched aspects of different MTHFR genetics is homocysteine and cardiovascular health. One of the biggest problems is people with homozygous MTHFR mutation, especially both of the big ones, the 1133, and those people usually have reduced methylation, and it connects with other genes in those same pathways and networks for methylation. And we'll look
Sure
at
it does.
those
So if we
in a
look at,
minute. We'll
yeah,
look at those
let me
running.
jump in. just for a sec. So yes, if people are under methylators, they are much more likely to not be turning the amino acids into the neurotransmitters, right? Because in the pathway that turns tyrosine into dopamine and norepinephrine, that turns 5-HTP into serotonin, we actually need enough methyl groups running around to make that
Exactly.
happen. And that's can be one reason why amino acids don't work, and a huge reason why psychotropic medications may not work.
That's exactly right. And uh, there are some doctors that minimize the effects of MTHFR. They say, oh, genetics, that's just hocus pocus. There's not enough research. And they say the same thing about TPH2 SNPs. They say the same thing about DDC, MAOA, COMT, even PNMT, DBH, all of these. And you know what? By themselves, these researchers, these critics are absolutely correct. By themselves, they have a small impact, not really a huge deal. However, and there's a big however, if you combine several of them in a row, so if you have low TPH2, low DDC, low MAOA, now all of a sudden you have systemic blockages in pathways and networks, and that can become a bigger problem. It's the same thing with anything else. If you just look at glyphosate, glyphosate is a little bad for you, but it's not horribly bad for you. And they did test after test, study after study, and they're showing, yeah, glyphosate is a little bad. But you know what? When I eat some corn chips, I'm not just getting glyphosate. I'm getting glyphosate and about another couple hundred other chemicals, some of which have been in the soil for decades, like DDT, some of which are new, some of which are not that persistent, others of which are very persistent. They're going to be in there for decades. And when you combine all of those, it becomes incredibly, incredibly bad for you, very deleterious to our health effects. And the same thing can be said for vaccines. Every vaccine has been studied very, very closely by themselves. And no vaccine is like really, really bad for you, right? There are benefits. You get antibodies to certain diseases. But when you have the entire schedule pumped in all at the same time, then the question is, okay, well, there's obviously something going on. I'm not saying all vaccines are good or all vaccines are bad, but certainly the schedule should probably be looked at, right? We should analyze it. And that's another problem that I see. There's a big push by pharma subsidized entities, organizations, and pharma themselves to call anyone that questions anything that they don't want questioned crazy or not smart, yeah, or sensationalist or fake. So I don't think that's a really good approach. I think a good approach is to have healthy skepticism and have an open discussion and not censor people, right? So
absolutely. And it seems to me that with this vax conversation, right, and you just said it, with the schedule where, a young child is getting exposed, or even somebody going into the military is being exposed to all of these vaccines all at the same time, it seems to me we could go back to that list of CYP, CYP variants, and the detoxification pathways. And I think that every baby should be given a full genetic test at birth, and their detoxification pathway should be analyzed as to whether that child is capable of detoxifying a variety of vaccines and everything in the vaccine all at the same time, or if there are children, because of their genetic pathways and their detoxification systems, are at really high risk for getting overloaded and therefore really, really sick. We know that
right,
not all children get really sick. The question is why? Why?
exactly,
Well, if
exactly.
you look at these SNPs, they can tell you exactly why.
Yep. So, for example, I ran a simple search in the program literature for pertussis, right? Whooping cough.
Mm-hmm.
And there is a gene called ESR1, estrogen receptor 1, which actually interacts with COMT. And people who
And good for
have
mental health.
people who have the T allele, or especially both copies of the T allele, have increased risk of pertussis. And there are several genes and SNPs that are associated with whether it's pertussis, diphtheria, any type of meningococcal diseases, Hib, all of these. So you can
But but
tell.
but look at that, Val. We also have increased schizophrenia, increased alcohol intake, increased depression, increased
Yep,
postpartum depression, increased mood and sleep disorders. They all
right.
run together.
Yep, exactly. And a lot of these have to do. It's because of uh, increased estrogens and reduced testosterone in some people. And if you look at the other copy, if you have the C allele, what does that have? That has increased testosterone. So there's a testosterone to estradiol connection, and there are obviously neurotransmitter issues because, as I said, COMT and ESR1 are very connected. So this is one way to figure out what you have issues with and what are potential, like, are there increased side effects from one particular vaccine, which very much speaks to your point that you made a couple minutes ago. Really, compared to $30,000, $40,000 that people drop at Cleveland Clinic, Mayo Clinic for various issues, genetic testing it's just a few $100. It really should be conducted on everyone. It's probably what, 3 or 4% of the cost of a birth nowadays.
Right.
So we're really talking about very, very, pennies on the dollar for potentially very important information. And not to get too off topic here, but yeah, that goes in any field. So if you look at any one thing, you zoom out and you see the entire system or network, then all of a sudden, drugs, supplements, lifestyle, different types of decisions like that become a lot more clear.
Mm-hmm.
Here's
So
one. Oh, go ahead.
go on, go on.
Oh, I wanted to show you one of the. Hold on. See if I could find it here.
Well, while you're looking, I've got a question. I've heard that there are some genetic SNPs that actually determine to what degree you might get or be affected by PTSD. Is that one of the serotonin SNPs?
Oh yeah, PTSD. There's actually a PTSD algorithm based on very large numbers of genetic tests that were done on people. These are called GWASs, genome-wide association studies.
Mm,
And PTSD, there's an algorithm available that looks at about 500,000 SNPs and gives you a very, very precise point, like how much PTSD do you have. So it's called psychological trauma in this particular test. And I'll zoom in a little bit here. So for me personally, I am on the 22nd percentile. So I don't have a lot of PTSD genetics.
mhm.
I probably wouldn't be here if I did, just because of just the different things I've um, seen in my life. Women are generally a little bit more prone to PTSD than men. Part of that has to do with estrogen and testosterone ratios,
Uh-huh.
and that even happens, like, even in a cycling woman, like during a part of the menstrual phase when
Sure.
she has higher testosterone, just mentally, right? She is
Right.
calmer, less phased, and then when that the shift happens with the LH and FSH, then progesterone, of course, changes, and there's more estrogen and less testosterone, and then there's just like a greater imbalance, right? That she's more emotional, things affect her more, and that's one reason why you really need to look at your genetics, because you don't have to have a bunch of PMS. You can actually, I mean, I'm not saying, take a bunch of drugs and narcotics to combat it, but you can gently do certain things to
Certainly, to balance out
Oh
those
yeah,
ratios between the different hormones. PMS is a major risk factor for relapse in women. It's the highest risk time during the month for relapse, as well as mental health issues, as well as being arrested for crime. And
wow, I did
we
not
have
know that.
found,
Makes sense.
yeah, we have found that simple interventions, such as eating protein every 3 hours rather than every 4 hours to stabilize blood sugar, taking extra 5-HTP, because as estrogen drops at the end of the month, so does serotonin. As progesterone drops at the end of the month, so does GABA. So by bringing in extra GABA or GABA support, bringing in extra 5-HTP or even St. John's wort, it evens everything out. Taking a phytoestrogenic herb like black cohosh can modulate estrogen. And again, women just like stabilize again and feel normal again, and their relapse risk drops down to zero.
Right. Isn't that something? So, so here are the recommendations based on this one program for PTSD. Let's say I had some PTSD symptoms. The first recommendation is psychotherapy, and the recommendations are listed in order of evidence and impact. So that would be one of the more
Right.
significant
But
ones.
there's no nutrients there.
No. So this is divided into supplement, dietary, and lifestyle. So as far
Okay,
as supplements, omega 3s
there we
are
go.
the highest ranked. DHA, L-arginine, NAC, D-serine, carnosine. Um, Notice how amino
Sure.
acids are missing in here. That's just because of the lack of evidence, the lack of the high level evidence. Unfortunately, that's required by a
Because they've
lot of
just not done the
allopathic.
research. They've,
Right,
they've just not done the research, because
exactly.
in
But we know it
clinical
works.
practice, I can tell you exactly what amino acids help
Exactly.
my clients with PTSD.
And we'll be and the new programs that I'm working on will have those. So all of our
Wonderful.
inputs will be in here as we launch those. And I know what you mean, and I'm excited to see what becomes of that as we as we evolve in that realm, in that domain. So this is essentially how this works. The other one I wanted to show you is really cool. Medical reports. So this one actually shows you risk of pretty much all diseases based on hundreds of thousands of these genome-wide association studies. So
Sure.
the triangle shows the highest risks. That would be cataracts, prostate cancer, seizures, bipolar, and celiac. Then you have the
Okay.
octagons, and the octagon exclamations are increased risk. So that's going to go, heart failure, liver failure, emphysema, etc. And then you
Ouch.
get
Is this
into
you?
this is me, yeah. And
Ouchie.
and here are the check marks. So the uh, the square or the diamond check marks is average risk. So
Hmm.
systemic sclerosis, myasthenia gravis. I just don't have the genetics for it. I could still get it, but it'd be milder, and it would be a reduced chances of me even getting it, right? Like for example, I think I had lupus.
Schizophrenia. You have more chance of getting bipolar disorder, but less chance of becoming schizophrenic.
Exactly. And then if you go all the way down to the bottom, see there's heart attack, liver sclerosis, dementia. If you go
Hmm.
down to the bottom, you get into the green. And so the green is all the diseases that you're actually protected from. So
Ooh.
mononeuropathy, I have a reduced than average odds of getting it. And if I did get it, maybe it's milder. Non-Hodgkin's lymphoma, probably not going to die of that. Diverticulitis, rheumatic heart disease, thyroid cancer, bladder cancer, et cetera, et cetera. So you can see how knowing your genetics, it's really important. Here's the longevity screener. This is the last one I'll show you before we go into the other stuff. So this one looks at your genetics, and it also asks you a questionnaire about family history, personal history, where your grandparents were born, etc. And this is a very accurate longevity screener. So lifetime risk of prostate cancer and bipolar is highest for me. This is 34 times higher. This one's 3 times higher. None of the others. Usually people have like 3 or 4 items in the red, but I only have 2.
You only have 2. So what are you doing to prevent your risk of bipolar disorder?
What do you mean bipolar disorder? That was a joke. Trying to be funny. When sometimes patients they have like depression, I tell them I'm sorry. Well, that's really sad, and then they start laughing. So you have to have a little fun, or else you're going to go crazy with this stuff.
Exactly, exactly.
So yeah, it's true with bipolar. If something requires my attention, I can go from 0 to 60 in about 2 seconds. However, I keep it very controlled, right? As opposed to wild animals, we have Homo sapiens, right? We think and we have feelings and we understand things.
Exactly,
But
and we can make decisions. So what
exactly.
are you using any nutraceuticals to support your brain around the bipolar disorder risk?
Well, I haven't really had a lot of bipolar tendencies, although I could totally see it in me. So I haven't really done too much of that. For me, ADHD has been more of an issue.
Ah,
So
okay. Well, and
I
bipolar
supplement
and
with that.
ADHD can often run together.
Right, right. So I do a lot of different amino acids, NAC. I use inositol, fish oils,
Mhm.
some B vitamins, lithium, and some other things. So I self-medicate intelligently based on genomics and metabolomics. But the important thing is, if you take away what you're probably going to die of, then you're not going to die of that, or there's a less reduced chance
Right,
of it.
right.
So I like to think of the analogy of a bunch of grim reapers sitting around at a long table, and then the prostate cancer grim reaper says, "Well, I can't kill Val because he's taken all this stuff to improve his prostate health, so he's not going to get that." So then the heart disease guy goes, "Well, I can't take Val out because he's taken all this stuff and he's doing well." And so basically they're just sitting around a table for decades and decades waiting for someone to finally get me. So it's going to take a lot longer, you see, if you
Hey, that
have the
works.
vision. Yeah. So that's one of the ways you can improve your odds of having a good health, not just lifespan, but health span.
Yeah,
So
yeah.
the ideal life is, a long, fruitful life, and then you're not sitting around in a hospital for years or decades, right, being sick. You maybe
Or
like
being
everything goes out,
depressed,
right,
or being so anxious you can't leave your bedroom.
right, right. And if you're so depressed or anxious, or you have OCD or phobias or panic disorder or anything like that, and it affects you significantly, in some ways you've already died, which is very sad. And
Mhm.
but the benefit of that is you may have in certain ways already died, but in actuality, you're not dead. You're alive, so you can fix things and you can get back to where you were before, or even better. Like for example, right now, at the age of 50, I have better thinking than I did when I was 20 or 30 in some aspects, and I
Uh-huh.
have a better physical fitness in some aspects than maybe 10 or 20 years ago because of different things that I'm doing with my body, as far as diet, lifestyle, supplements that I didn't know back then. Like
That's
for
right.
example,
Me too. Me too.
yeah, like I was as a kid, I was chronically constipated. I probably had significant IBS. Now I don't have much of it at all, and I don't have any constipation issues or any kind of issues like that at all. And all of that is possible for almost anyone. So it's
It
really
is.
nice to be able to see that. And then I wanted to
And
show you. Um,
okay, you can show us one more thing because then we do have to wrap this up.
sure. So this is a genomic spotlight sample report. Let me get it open. So this is a genetic test that you can do at Designs for Health. You could upload other programmatics too. And the person who wrote this is also Dr. Diadamo. He worked in conjunction with Dr. David Brady to design Genomic Spotlight. So here's my Genomic Spotlight. And it kind of looks at different hormonal protocols, prostate supreme, libido stim. These are different supplements that work based on recommendations
Right,
made in the
because of the
program.
risk of prostate cancer.
Exactly. And that's one of the things I do. I try to think outside the box, right? And there are 8 categories in the test. And I'm trying to, I see what's going on. So the program froze a little bit. There it goes. Now it's working. So this is the hormonal multi-slip algorithm. So I have low likelihood of high cortisol, but I have increased risk of low testosterone. And I also have reduced TSH levels. So it's nice to be able to see what your genetic tendencies are. And here are some of the SNPs that were used in the report. There's a gastrointestinal protocol for which I'm currently using a Canab Omega and Immunomod. Immunomod has a lot of N-acetyl glucosamine. Canab Omega has fish oils and CBD oil. So here's a predicted serotonin, gut serotonin activity, elevated gut serotonin. So if someone has, let's say someone has chronic diarrhea, right? And they have predicted elevated gut serotonin activity. Are you going to give them 5-HTP? Probably not, because then they're going to have even more diarrhea. Sure, they might improve their mental health a
You're going
little.
to give it to them sublingually rather than in an oral capsule that's going to go to the tummy.
That's right, because a surprisingly little amount of it actually gets out of the GI tract and goes to the brain. Higher support for acromansia. That's probably because I'm a FUT2 non-secretor. Lewis non-secretor status affects diversity and a lot of other things in the microbiome. Lactose intolerance, I have the lactose intolerance genetics, candida, high candida carriage. I just did a microbiome test and I don't have any candida because I know how to prevent its accumulation in the body. So if you had candida, it's a lot easier to get rid of it if you know which pathways to work on. Gluten sensitivity. Anyway, there's a bunch of these. There's one for mental health. There's a methylation one. There's
one that sounds like very, very good. And we're going to put this in the show notes so people can have access to you and to some of these tests. So if somebody wants to get in touch with you, Val, how do they do it?
Oh, they would just send an email to geneticwellbeing@gmail.com.
Okay.
And then we would order some of these Designs for Health tests, or there's some other tests as well. There's a genomic spotlight. There's also a genomic insight test, and there's a lot of them. Everybody eventually settles on what they want to do. So we figure out what their goals are, what they want to spend. People are on a budget. I would say just get the labs through your doctor, or I could order them some discount labs, just basic labs, cortisol, sex hormones, cholesterol, blood sugar, A1C, calcium, sodium, all the standard CBCs. And then maybe like a low-level genetic test. That wouldn't be too expensive. People who want to spend a little bit more money, you can get just an obnoxiously good amount of information for maybe $1,000 or two. You could really, really get to the root cause of pretty much anything.
And for very ill people, and I would say your chronic relapsers, your person who's gone from program to program to program, it might be worthwhile investing in some of this to actually identify the underlying biochemical, brain chemical reasons for this.
Right, exactly. That about says it.
Well, Val, thank you so much. This has been very illuminating. It certainly answered some of my questions about some of these genes and how we identify them and what to do about them. And I so look forward to seeing you at the conference in May.
You got it. It will be my pleasure. I will see you there, probably before as well.
Probably before as well. Yeah, we've got some things we're planning.
Exactly.
All right. Well, I really wish you well and thank you.
Thank you. Happy New Year.
Happy New Year to you. Thank you for tuning in to Power Up Recovery with Nutrition. I'm Christina Veselak, your host, and I hope today's episode has inspired and equipped you with new insights and tools to support your recovery journey or practice. If you enjoyed this episode, please subscribe, leave a review, and share it with others who could benefit from the knowledge shared here. Stay connected with us for more episodes filled with practical advice, expert wisdom, and inspiring recovery stories. Remember, nutrition is a powerful tool in mental health and relapse prevention. Power up your recovery today. I'm Christina Veselak, and I'll see you next time.